Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on the Surmount 4 randomized clinical trial evaluating continued therapy with tirzepatide for maintenance of weight reduction in adults with obesity, published in JAMA. The objective was to assess whether continued therapy with tirzepatide maintained weight reduction in adults with obesity. It was a phase 3 randomized withdrawal trial conducted at 70 sites across 4 countries. 783 adults with BMI equal to or greater than 30 or BMI equal to or greater than 27 plus weight-related complication except diabetes were enrolled. Intervention: 36-week open-label tirzepatide lead-in followed by a 52-week double-blind phase was conducted. Tirzepatide versus placebo in the 52-week double-blind phase. So study duration was from March 2021 to March 2023. What were the key findings? There was weight change from week 36 to 88. There was a 5.5% weight loss in the tirzepatide group. In the placebo group, there was a 14% weight gain. The total difference was 19%. Regarding weight maintenance at week 88, 89.5% of the tirzepatide users maintained at least 80% of their initial weight, whereas only 16% of the placebo group maintained weight loss. Adverse events: mild to moderate GI events, nausea, diarrhea, and constipation. Clinical impact and conclusion: continued tirzepatide therapy prevents weight regain and enhances weight loss, supports long-term pharmacotherapy for obesity similar to hypertension or diabetes. Cardiometabolic benefits were reversed upon stopping tirzepatide. Potential implications for long-term weight management strategies in clinical practice. So the takeaway: stopping tirzepatide leads to substantial weight regain, reinforcing the need for ongoing therapy.